Hi everybody. It's very important that we look after our mental health, our mental well-being. Um, but sometimes it's out of our control with an illness. Now there's a few different illnesses and some are genetic. Some of them are the ones like schizophrenia, schizoid affective disorder, and bipolar. Um, but the thing is, we can all experience like a stressful day every now and again, but that's not the same as having an illness or an illness starting to starting to occur. It actually, how it would actually occur is on a gradual process. Gradually, you may not at first even realise that you're suffering with an illness, because it's so gradual, so slow. You may start to feel a change in yourself. You feel change like go within yourself, start to affect your emotions, your feelings and emotions start to feel repressed. You may even like if you're like very sociable, you might just want to shut yourself away from all that. And gradually you may start to feel like you're lacking energy, low mood, or changes in mood, like mood swings as well. You may as well start along the line start to feel like those the thoughts you might start experiencing unusual thoughts that you never would have been thinking before, and you may even start to feel detached from reality, like living in like a different world, like detached from everything. But there may be like people like around, like the ones close to you, like your family, they may notice the change in you, but it's how would you approach someone like that? It could be very hard for the family as well, like seeing someone like the change in them. But it's just about like how you would approach somebody as well. It's like you being very subtle about, in a way of conversation, and letting them know that you're there for them and you're there to support them. Because if you're getting certain signs, it needs to be checked out. So it's like giving someone the encouragement to do so, because like I said, they may not at first realise what's going on. They may feel confused about it, and then eventually realise there's something not right, but feel confused and maybe find it difficult of how to explain what's going on. So they may feel they find it hard to explain to someone like close to them, like their family. They may feel that they find it easier to speak to a stranger, like seeing a doctor. A doctor's a stranger. A doctor's there not to judge people. They're there to help. You've got to remember, they're there to help you and give you that support. Now, that's your first steps. The first steps is recognising those signs and knowing that you need help. So it enables you to get treatment. That's your first steps. It is important to recognise those signs and get the help. And it's important to have the treatment for it, because before there wasn't no like early prevention for it. People were waiting for like long periods of time with referrals to see a doctor, to see someone about it. And the longer it was going on, the more people you're suffering even more, because you need treatment for it. So that's your first steps, and then that enables you to get the treatment to start your recovery. And it's important as well to have people like the support team around you at first, and your family like around you to support you, so you don't have to deal with it all on your own, because it could be very, I can imagine it would be quite hard to do so. But then eventually, it's like a slow process in your recovery. And then you start to find them coping strategies that helps you along the way, those tools. Though you've got the coping strategies that you learn that will help you with your recovery, and you've got them there as well as backup for when you need them. So then eventually along your recovery, along the way, along your journey, you start to feel and able to feel a bit more independent and able to cope with it yourself, because you've got them tools, those coping strategies to help you. And then eventually you start to get more confidence in it. You not start to feel afraid of the illness, so you feel a bit more confident. You may even start along the way as well to see the world again, what it was like, notice things around you and being a bit more aware, like things you may have blocked out before, like noticing things, like hearing the birds singing, just little things, it's all part of your recovery. And then eventually, you start to be able to live a normal life with it. And it has been known as well that people have come through illnesses and made something of their self, but all along they've still got them backup tools for when they need it. So it is possible to live a normal life. But the point of the video I wanted to do was recognising signs, how important it is to recognise the signs and to get help, to start and to get treatment. So I hope the video was of some help. I hope you enjoyed watching the video. Take care. Give us a like.